We're closing in on 2 months since the COVID-19 vaccine started being distributed, but people still have questions. Our Kenesha Dees hears from a doctor at UAB on what to know about the vaccine before, during, and after you receive your dose.
Doctors say the decision to get the vaccine is one conversation to be had with your primary care physician. However, here's what they also say about vaccine safety.
We can say that by far, for most people, the COVID-19 vaccine is safe if you are 16 and over.
Dr. Erin Delaney, a family medicine physician, has been asked which vaccine is better, Pfizer or Moderna.
Have very similar efficacy rates, so there would be a little difference in terms of the efficacy there.
Another big question are the symptoms following vaccination. Symptoms such as a sore arm are normal. However,
if you are experiencing symptoms that last longer than those 36 to 48 hours, then I would certainly reach out to your primary care provider and discuss your symptoms with them.
People have asked if taking over-the-counter medicine such as Tylenol would have an effect on someone before vaccination.
Currently, I do not believe that we have evidence to suggest that. I would still recommend that you hold the Tylenol and only take it if you felt like you needed it after the vaccine.
So far, doctors say they do not have research to support whether someone could be infected by the virus after receiving their doses.
Hope is that if you did contract COVID-19 after you've been vaccinated, that your symptoms would be very minimal, and that we also hope that the risk of spread would also be minimal.
Delaney says you still need to follow CDC guidelines even after you're vaccinated.
That includes masking, practicing social distancing, washing our hands, limiting our activities that would put us in crowds.
Putting the Valley first, Kenesha Dees, WZDX News.